You know, we've been talking so much and showing you so many images of all the devastating flooding in western North Carolina. Doctors are warning of health dangers hidden in these waters. Things like hepatitis, E. coli, COVID even could all be concerns. WRAL health reporter Grace Haba shares advice from a local doctor on how to stay safe.
All over western North Carolina, sites like this, murky floodwaters where bustling towns once stood. Doctors now warning of potential dangers lurking below the surface.
There are going to be concerns for things like norovirus diarrheal diseases, E. coli, which can cause severe diarrhea, potentially even things like hepatitis A.
Infectious disease expert Dr. David Weber with UNC Health says your skin is naturally a good barrier against infection, but it only takes a small nick or scrape to open the door to a host of problems. WRAL has learned of at least one Appalachian State student who returned to Raleigh and tested positive for the bacterial skin infection cellulitis. The student's doctor said it was likely from contaminated water.
People need to be very careful of injuries while they're in water and trying to go from place to place or fix their houses. So there are a number of bacteria, they're skin bacteria like group A strep that can cause severe skin infections.
Drinking contaminated water also poses major health risks. Boiling water will help protect against bacteria, but it won't remove things like chemicals that could easily have spilled during the heavy rainfall. Weber also warned people who are unvaccinated and staying in shelters could be at a higher risk for respiratory illnesses like flu, COVID, measles, or rubella.
All it takes is one person in that shelter who has one of those diseases that could spread as well as, again, the diseases if they can't get fresh water, like norovirus particularly, would be of large concern.
Grace Haba, WRAL News.
And also some illnesses, can take a few days to cause symptoms. So if you or a loved one notice any changes to the skin or have respiratory symptoms, seek medical care.